Hey everybody, my name is Danny, and this channel is called Operation Los Algodones. One of the questions that a lot of people ask me, the people who are in touch with my journey and know about it, my journey to Los Algodones, is they ask me, did the dental implant procedure hurt? So I thought I'd take this opportunity to explain exactly what it was that I went through when I had my implants put in. Now keep in mind, I had a full mouth of implants put in, 10 in total, with 5 on the bottom and 5 on the top. This process would be referred to in the industry as all on 5, meaning that each arch is anchored by 5 implants, 5 on the top, 5 on the bottom. For me, they were all put in one day. One long day, but yeah, 10 total implants done in a day. Now let's talk about pain. I'll start by saying that my extractions, which had happened 4 months prior to receiving my implants, was far more traumatic for me. I had 26 teeth extracted within about 2 hours. Again, 4 months prior to receiving my implants. The extraction procedure was far more traumatic and far more painful for me. I had actually expected the implant procedure to be at the very least as painful as the extractions, but it wasn't. Now, was it painless? No, it wasn't painless. Although I would have to say that a lot of the pain was probably actually psychosomatic, and honestly was almost imaginary because of the piercing sound of the drill. I would venture to say that the overall takeaway would be classified more as uncomfortable than actual pain. It is a bit uncomfortable depending on the amount of Novocaine or local anesthetic used when the implants are actually being screwed into your jaw. I personally was awake for the entire procedure and chose to forego the option of being knocked out. Honestly, I think the majority of my pain was from the Novocaine needle. You know how once the Novocaine wears off, your mouth is just kind of sore and achy from the needle more so than anything else? What was incredible to me was the following morning. With the exception of the lingering dull pain from the Novocaine needle and a very slight headache, I pretty much felt fine. Keep in mind, my mouth in general felt different. During the healing process, I did notice, for example, when I smiled, I felt almost a horizontal stretch type of feeling across my chin. Painful? No. Different than what I was used to? Yeah, absolutely. As a side note, that stretched feeling has completely gone away, and I would assume that was a result of the swelling. Obviously, there was some swelling that I experienced, but again, nothing that really altered my appearance. If I had to personally make a recommendation based off my experience, I would say that your best bet is to probably take a few days off of work following the dental implant procedure, because again, there were mild headaches involved in the days immediately following. There was some minor swelling, and maybe it's just me, but the Novocaine tends to knock me for a loop. And there is quite a bit of Novocaine involved with the dental implant process. Maybe I'm a baby, but it took me a few days before I was ready to get back to business. People are also curious about pain management and prescriptions when having dental implants done in Los Algodones. Now keep in mind, at the pharmacies in Los Algodones, pretty much everything is over the counter, and everything is considerably cheaper than it is in the United States or Canada. Now, when I was finished with both my extractions and my implants, the dentist pretty much writes you a note as to what to get at the pharmacy and how often to take it, whatever it may be that he recommends. For me, with both my extractions and my implants, it was Ketorolac for pain and amoxicillin as the antibiotic. And from what I can tell, that seems to be the Los Algodones go-to, or the typical 1-2 punch for any sort of semi-invasive or invasive procedure that they may perform. Now, everyone knows about amoxicillin, it's an antibiotic, but they may or may not be familiar with Ketorolac. Ketorolac, like any other drug, is marketed under different brand names. In America and Canada, Ketorolac is marketed as Toradol and is only available by prescription. It's a non-steroidal anti-inflammatory drug that would be in the same drug class as ibuprofen or naproxen and is used to treat pain. It's specifically recommended for moderate to severe pain, and the recommendation duration of treatment is less than 6 days. From my experience, Ketorolac or Toradol came in the form of a very small pill that you place under your tongue. Within about 5 minutes, it's entirely dissolved, and believe it or not, does not leave a horrible taste in your mouth. Ketorolac was all I really needed to deal with the pain and discomfort I experienced in both my extraction procedure and my implant procedure. And although, again, it is indeed only available in the United States and Canada by way of prescription, because it's not classified as a controlled substance, U.S. Customs will give you no problem bringing Ketorolac or amoxicillin back and forth with you across the border. Another side note, for whatever it's worth, would be to stay on top of the antibiotics. It is so important, obviously, to keep swelling under control and to make every effort to avoid any chance for infection. As someone who before my dental implants literally lived 75% of my life stuck in some miserable dental nightmare, most of the pain that I experienced from actual dental procedures was usually from post-process swelling. Now, obviously, that has nothing to do with the chronic dental pain that I lived with, but as far as procedures go, as I'm sure you know, staying on top of the antibiotics can save you quite a bit of unnecessary aggravation. Overall, if for whatever reason you're hung up on or hesitant in regards to dental implants because you fear the pain, don't. The minimal pain/discomfort that you may or may not experience is hardly a worthwhile factor to concern yourself with. For me, every ounce of pain or discomfort that I dealt with was 2,000% worth it. A few $1,000 and a few days of discomfort was a very, very small price to pay to escape from 35 plus years of being locked in a dental nightmare. Operation Los Algodones is going to be an all-encompassing channel that's designed to serve you, the consumer. I want to help simplify your process and load you up with all the information you need to make an educated decision when it comes to considering Los Algodones. We're going to talk travel, we're going to talk hotels, Los Algodones dental providers, Los Algodones pharmacies, and Los Algodones optical, just to name a few things. I'm going to make every effort to arm you, the consumer, with as much practical information as I can. I would ask that you please both like this video and subscribe to my channel if you're eager to hear more and learn more about everything that Los Algodones and its neighboring communities in California and Arizona have to offer. Thanks for joining me today, and I really, really hope to see and hear from you in the comments on this video and in my upcoming videos. Thanks.